I'm Syna Gupta, and my topic was chemotherapy-induced alopecia. My introduction. So the main topic of my research was chemotherapy-induced alopecia, its causes, psychological effects, and preventative measures. So cancer affects millions of people each year, and on top of that, more than 65% are forced to deal with hair loss as a result of their chemotherapy. So this research paper is aimed to elaborate upon this issue along with answering the questions of what the best strategy to combat this issue is due to not only the physical loss, but also the emotional loss surrounding it. Causes and effects. So through a qualitative secondary literature review, I found data that displayed the main cause for chemotherapy-induced alopecia. Basically, chemotherapy is used so it could target cancer cells because they're so rapidly dividing. But because hair follicles are also very quick in dividing, then they're also targeted and killed by chemotherapy drugs. So this results in chemotherapy-induced alopecia. This also then leads to the psychological effects of it, which for many women include a feeling of loss of identity, self-confidence, and strength. And they also suffer from like embarrassment. And then preventative strategies. So upon research, I did not find any necessarily guaranteed solution to the issue of chemotherapy-induced alopecia, but I did find that there is a strategy that combats it more than not doing anything. So I found that cooling caps, also known as scalp cooling, is a method that has undergone multiple clinical studies. These studies have shown that a cooling cap, which is used as it's used to cool the scalp before and after chemotherapy treatments, uh, to stop the blood from circulating in the scalp as much, which then makes sure that the chemotherapy doesn't target it as much as well. It is shown that it doesn't completely prevent it, but it does lessen the amount of hair loss occurring within the chemotherapy patients by around 50%. And then my conclusion is that as chemotherapy becomes a more widespread method of cancer treatment, the side effects of it also become widespread. The issue of chemotherapy-induced alopecia has created a physical issue of hair loss, but also psychological issues. As a result, it is necessary for a treatment or a therapy method to be created in order to combat the massive amounts of hair loss. Although there isn't a guaranteed solution currently, the most effective method includes cooling caps. Alongside that method, there is other cancer treatments, but since this is just chemotherapy-induced alopecia, the only real treatment for it is cooling caps. And yeah, I think that's all. Thank you.
Wonderful. You want to share your experience about the program?
Yeah, Dr. Virgil was very helpful in creating helping me create a structure for my topic. And Professor Prahlad actually helped me a lot. I was able to find a bunch of information and create a chart and go through a bunch of clinical studies with his help.
Great. A question from Dr. Prahlad.
Yeah, so you mentioned that except for cooling caps, nothing else helps alopecia, right? Because chemotherapy is constantly targeting the thing. So anything else came up in your research, like group therapy or counseling, at least for the, the trauma part?
There's definitely group therapy. I think that also along with that, there was many methods of like covering their head that for many women it felt more comforting and less embarrassing.
Okay, yeah, excellent job. Congratulations.
Yeah, thank you, Syna. In my other research program for infectious, no, I have another student who really struggles from alopecia. I mean, not due to cancer and everything, but
Mm.
it's like such a nice connection that you're doing research on the effect of cancer on alopecia, and he actually has alopecia. So it's all wonderful. Thank you for sharing your research. Really good. We want you to continue with this. And everybody, we are introducing newer programs to convert your research into a passion project so that you can continue dwelling in the field that you are. We're also having good media coverage and success. So we want to help you promote your achievements in newspapers and other places as well. So stay in touch with us and we'll let you know how. Okay.